In this podcast episode, Dr. Mark Hyman, a renowned functional medicine physician, discusses the alarming state of health in America and the systemic issues contributing to chronic diseases. The conversation delves into various topics, including the food system, the importance of preventive health measures, and the role of lifestyle choices in determining overall well-being. Dr. Hyman begins by addressing the current food system in the United States, which he argues is designed to fail the population. He highlights that approximately 60% of the American diet consists of ultra-processed foods, which do not meet the basic definition of food as something that supports health and growth. This alarming statistic is compounded by the fact that 1 in 4 teenage boys is now facing prediabetes or type 2 diabetes, a situation that Dr. Hyman describes as a national emergency. He emphasizes that if a foreign entity were harming American children in this way, there would be an outcry. Yet the food industry continues to operate unchecked. The conversation shifts to the role of the food industry in shaping public health. Dr. Hyman explains how lobbying efforts and corporate interests have corrupted the understanding of nutrition. He points out that the food industry funds a significant amount of research, often skewing results to favor their products. This manipulation has led to widespread misinformation about what constitutes healthy eating, leaving many Americans confused and misled about their dietary choices. Dr. Hyman reveals that a staggering 93% of Americans are metabolically unhealthy, with many suffering from chronic diseases. He discusses the slow, imperceptible shift from wellness to illness that many people experience as they age, often attributing their ailments to the natural aging process. However, he argues that these symptoms are not normal, but rather signs of dysfunction that can be addressed through lifestyle changes. The conversation highlights the urgent need for a paradigm shift in how society views health and aging. The discussion also touches on the alarming statistics surrounding chronic diseases in the U.S. Dr. Hyman notes that 81% of Americans are on medication and many spend the last years of their lives in poor health. He emphasizes that this decline is not an inevitable part of aging, but rather a consequence of lifestyle choices and environmental factors. By addressing these issues, individuals can reclaim their health and improve their quality of life. A significant portion of the conversation focuses on the need for preventive health measures. Dr. Hyman advocates for a proactive approach to health, emphasizing the importance of regular screenings and lab tests to catch potential issues before they escalate. He criticizes the traditional medical model, which often waits for patients to exhibit symptoms before taking action. Instead, he encourages individuals to take charge of their health by seeking out comprehensive testing that can reveal underlying issues. Dr. Hyman introduces the concept of biological age, which can differ significantly from chronological age. He explains that biological age is determined by various biomarkers and can provide insight into an individual's overall health. By understanding one's biological age, individuals can make informed decisions about their lifestyle and health practices, ultimately leading to a longer, healthier life. The conversation also delves into the importance of exercise and physical activity. Dr. Hyman shares a humorous anecdote about his mother's aversion to exercise, highlighting the common misconception that physical activity is something to be avoided. He stresses that regular movement is essential for maintaining health, especially as people age. The discussion emphasizes that exercise is not just about weight loss, but is crucial for overall well-being and longevity. Dr. Hyman explains that strength training and cardiovascular exercise are vital components of a healthy lifestyle. He notes that maintaining muscle mass is particularly important for older adults, as it directly impacts their ability to perform daily activities. By incorporating regular exercise into their routines, individuals can significantly improve their health outcomes and reduce the risk of chronic diseases. Dr. Hyman provides valuable insights into nutrition and dietary choices, emphasizing the importance of consuming whole, unprocessed foods. He argues that the key to a healthy diet is simplicity: eat real food, avoid ultra-processed options, and focus on a variety of fruits, vegetables, nuts, and clean proteins. He acknowledges that the abundance of conflicting information about diets can be overwhelming, but he encourages listeners to return to the basics of nutrition. The discussion also touches on the impact of modern agricultural practices on food quality. Dr. Hyman explains that many fruits and vegetables today are significantly less nutritious than they were decades ago due to soil depletion and industrial farming methods. He advocates for regenerative agriculture as a solution to improve food quality and restore nutrient density in crops. By supporting sustainable farming practices, consumers can contribute to a healthier food system. Dr. Hyman highlights the dangers of ultra-processed foods, which are designed to be addictive and often lead to overeating. He explains that these foods hijack the brain's reward system, making it difficult for individuals to recognize when they are full. This phenomenon contributes to the obesity epidemic and the rise of metabolic disorders. He urges listeners to be mindful of their food choices and to prioritize whole foods over processed options. The conversation also addresses the marketing tactics used by the food industry to target children and promote unhealthy eating habits. Dr. Hyman points out that many children are exposed to advertisements for sugary cereals and fast food, which can shape their preferences and eating behaviors from a young age. He emphasizes the need for greater awareness and education around nutrition to combat these influences. The episode discusses the role of technology in health monitoring and management. Dr. Hyman introduces the concept of using wearable devices and health apps to track various health metrics, such as sleep patterns, physical activity, and dietary intake. He believes that technology can empower individuals to take control of their health by providing valuable insights into their daily habits. Dr. Hyman also mentions the importance of comprehensive lab testing, which can reveal critical information about an individual's health status. He co-founded a platform called Function Health, which offers access to a wide range of lab tests at an affordable price. This initiative aims to make health monitoring more accessible and encourage individuals to take a proactive approach to their well-being. The conversation touches on the connection between mental and physical health, emphasizing the importance of addressing both aspects for overall well-being. Dr. Hyman discusses how stress, anxiety, and depression can negatively impact physical health and contribute to chronic diseases. He encourages listeners to prioritize mental health and seek support when needed. Dr. Hyman also highlights the role of social connections and community in promoting mental well-being. He believes that fostering relationships and engaging in meaningful activities can significantly improve one's quality of life. By nurturing both mental and physical health, individuals can create a more balanced and fulfilling life. As the episode draws to a close, Dr. Hyman shares his vision for the future of health and wellness. He believes that a shift towards preventive care and a focus on lifestyle changes can lead to a healthier population. By prioritizing nutrition, exercise, and mental well-being, individuals can take charge of their health and reduce the burden of chronic diseases. Dr. Hyman emphasizes the importance of education and awareness in driving this change. He encourages listeners to seek out reliable information about health and nutrition and to advocate for policies that support a healthier food system. By working together, individuals can create a healthier future for themselves and their communities.